Hey, Master Coach G here, thriving after 50, mind, body, soul. And in this episode, I am talking about sleep apnea. There are thousands of Americans that have been diagnosed with this disorder, and I want to talk about it. A dear friend of mine that I've known for 25 years or more was talking to me about how she was diagnosed with sleep apnea, and I told her I wanted to research it because I just want to know more about it. And so that's what I'm doing this episode on. So make sure you stay tuned. This is Master Coach G, and I will see you on the inside. Hey fam, Master Coach G here, thriving after 50, mind, body, soul. And in this week's episode, I am going to be uncovering a subject that thousands of Americans have been diagnosed with, and that is sleep apnea. Sleep apnea is a disorder, and it happens when you're sleeping, of course. That's why it's called sleep apnea. And it's where it has something to do with your breathing. Your rhythm for your breathing is off. It's a disorder where breathing repeatedly stops and starts during sleep. The pause in breathing can last anywhere from a few seconds to over a minute. And this happens most of the time, dozens of times, sometimes even hundreds of times during the night. And that is why a lot of people who have this disorder will go and have some testing done. Usually it's an overnight testing thing, so that someone can monitor how many times a night that you actually stop breathing, so that way they can get a better diagnosis and be able to treat you. Now, there's 3 different types of sleep apnea. The first one is called obstructive sleep apnea, OSA. That's the most common one, and it happens when the throat muscles relax too much during sleep, because it causes the airway to collapse and become blocked. Okay, so that's obstructive sleep apnea, OSA. The second kind of sleep apnea is called central sleep apnea, CSA, and that's caused by the brain not sending a proper signal to the muscles that control your breathing. Amazing, isn't it? Yeah. So that's called central sleep apnea, CSA. The third kind of sleep apnea is called mixed sleep apnea, which is a combination of the obstructive along with the central sleep apnea. That's the third kind. So you could have a mixture of both, or you can have one or the other. So that is, so what I want to do now is I want to kind of get into what causes those reactions and the disorder itself. So what causes it depends on the type of sleep apnea that you have. For the obstructive sleep apnea, the OSA, relaxed throat muscles, tongue muscles during sleep is what causes your airways to be obstructive. Narrow airway can be a structural or due to excess soft tissue in your airway. Okay, here we go. And I wasn't really surprised when I read this part, but I know that it can be true. Obesity, okay, extra fat around your neck can put pressure on your airway, which can cause sleep apnea. So I guess if you're obese and you want to eliminate sleep apnea, one of the things you may want to look at is definitely your health, your diet, your sleeping habits, and things of that nature. Because that extra fat around your neck definitely adds pressure to your airway. When you're laying down, it's going to fall back, okay? Large tonsils or adenoids, that's another thing that can cause sleep apnea. Smoking, alcohol, sedatives, those things relax your airway, which can cause you to have sleep apnea, okay? Nasal congestion, of course, structural tissues like if you have like any type of scar tissue, Okay, whether you've had like throat surgery, nose surgery, anything like that, but the nasal congestion is definitely a structural issue. Okay, now for central sleep apnea, CSA, the problem is with the brain. Okay, the brain's respiratory control center. Okay, we have like different sections of our brain, and each section does something different. So the part of the brain that controls the respiratory center is often linked to a neurology condition like a stroke or a heart attack or heart failure, things of that nature. So because you kind of have like that disconnect, if you will, that is where the problem lies. Okay, certain medications, especially opioids, can cause you to have the CSA, the central sleep apnea, because now you're talking about something that's affecting your brain. It's altering your brain function. Okay, so medication and especially opioids can definitely affect the signals in your brain to have a reaction. It triggers that. Okay, high altitude sleeping, that's temporary though, because it's like if you're trying to sleep on a plane or something, but you don't sleep on a plane every single day, so that is like a temporary CSA. Okay, but here's the thing: the consequences of untreated sleep apnea can include chronic fatigue, high blood pressure, heart problems, stroke risk, and even your metabolism issues. Okay, so you want to make sure that you're careful of having it untreated or not even properly diagnosed. Okay, so what I like to do is if I address an issue, I also like to come up with some ways that holistically, all naturally, that we could actually work on it. And I'm not saying it's going to get you to the place where you're completely well of it, but and it's going to take time, because again, this is something that you have to practice. Anything holistic, it has to be practiced. Okay, so yes, while sleep apnea, especially the objective, I mean the obstacle that may be in your that is blocking your airways. Okay, the OSA, yes, there is medical treatment, but there's also natural and lifestyle based approaches that can reduce it. Again, practice is something that you have to practice. So these remedies are to improve your airways openness. Okay, so one of the things that I think I talked about a few weeks ago, maybe a month or so ago, was inflammation. Okay, so some of these remedies are going to reduce the inflammation in your body, which is going to help you support healthy breathing patterns. Okay, so I want to give you a breakdown of some all natural approaches. Okay, number one, your weight management. Even the most modest weight loss, 5 to 10 pounds, can significantly reduce your OSA. Okay, so people who are overweight, you may want to take a look at your weight, and even if it's 5 to 10 pounds, you will be able to notice a difference, because you won't have that weight on your airways. So yes, definitely check out your weight management. That's number one. Excessive neck and abdominal fat can narrow and push your diaphragm up. So if you have a lot of fat around your neck, or if you have a lot of fat around your waist, what's happening is that it's pushing your airway, is pushing your diaphragm up, which is actually another way of blocking your airways. So you want to make sure that you do not have that excess fat. And I know that a lot of people who have that, 9 times out of 10, they do have sleep apnea. So we want to make sure that we are looking at our weight management. The second thing is our position while we're sleeping. Sleeping on your back can worsen the airways collapsing. So I personally don't sleep on my back. I had to practice for about 10 months of not sleeping on my stomach, and because it was a habit that I've had all my life of sleeping on my stomach. So I had to learn how to sleep on my side. I had to use lots of pillows for about 10 months, and I had to practice. So that's why I'm telling you, anything that's holistic, is you have to practice. So definitely check out your sleeping position and your weight. Those two things are major. Side sleeping is often reduces your sleep apnea. You know, I would say try getting some pillows. Put a pillow between your knees. Put a pillow behind your back. If you're sleeping on your side, because you do have to train your body to sleep on your side if you're not a side sleeper already, and it does take time. It can be frustrating because when the pillow comes from between your knees and you're turning over, it'll wake you up, especially if you have a habit of, sleeping on your, not sleeping on your side. So, again, that does take practice, okay? Breathing and airways exercise, strengthening the tongue, throat, and the soft palate muscles can improve airway stability. I know that we talk about exercise in our bodies, but there's so many parts of our bodies that can be strengthened from exercise. It's like every day I have a routine. Doesn't have anything to do with sleep apnea, but I'm just talking about routine. It's like we don't think about the muscles in our face, and I make it a point to make sure that I massage the muscles in my face because I want them to get some form of exercise. So you have to look at it like this. You're strengthening your throat and your tongue and your palate muscles so that you can improve your airways. And I know it may seem like, wow, that's kind of strange. Well, yeah, but if you have sleep apnea, you'll practice on strengthening those muscles because, again, they will need to be strengthened in order so that they don't collapse. Singing or playing a wind instrument, like a clarinet, a flute, a trumpet, a saxophone. If you like music, I'm not saying you gotta, take classes or anything, but, get one of those little recorders. Remember when we were in school, when we were in like grade school, middle school, we had those they were almost like little flutes, but they called them recorders, but I always called them flutes. But even something like that, very inexpensive, just practice on, blowing in that. That will definitely help you to, it's almost like therapy, if you will. It's oral exercise. And so you can, YouTube has it. You can find anything on YouTube. So I would say definitely go and look up some exercise for your tongue, your throat, and your soft palate so that you can strengthen those muscles. Okay. Reduce airway irritation. Okay. So if you are a smoker, you may want to consider quitting smoking because it definitely affects your airways. Okay. Limit your alcohol, limit the sedatives that you take because those things relax your muscles, and which causes your muscles, if your muscles are too relaxed, and it goes right back to the disorder. So that's why we need to make sure that we're paying attention to that. Now let's address the nasal congestion, okay? I would say use a saline spray or a netting pot to clear the passage, okay? So once you clear that, then you'll be able to breathe a whole lot better, okay? Keep the bedroom moist with a humidifier because it definitely helps you to keep your airways open, okay? Treat any type of allergies that you have, and I would say try natural things, like raw honey is good for that. So, and there's a couple other things that you can try as well. And here's something else that's really important: an anti-inflammatory diet. Okay, focus on whole foods, unprocessed food. Focus on green leafy foods, berries, omega-3s, fish, nuts, and seeds. Those things are really good to help you to get rid of any type of inflammation inside your body. And I would say, make that a habit of eating those things. Make it a habit of eating whole food and staying away from processed food and eating a lot of greens and berries and omega-3s and fish and nuts and seeds, okay? The other thing is limit your sugar, okay? Processed food, sugar, and dairy. Number one, the dairy causes mucus, and that can be a problem for your airway. So yes, stay away from limit your sugar, the processed food, the dairy, and stay away from dairy if you can, because it does create mucus. Okay. Now, you always hear me talk about sleep is one of the four pillars that I always talk about. A consistent sleep schedule. Okay, irregular sleep patterns can make sleep apnea worse. Okay, because it makes it worse by disrupting the muscle tones and your breathing rhythm. So set a bedtime and stick to the bedtime, because your body gets used to you doing things like, it's developed a habit, it's developed a routine, and it knows that at 9 o'clock every night your body is ready to go to sleep. So if you start a habit and be consistent with your sleeping schedule, you'll find that you have a routine and that your breathing rhythm will get on track as well. Okay, you can also try herbs and some type of nutritional support. And I would say check with your practitioner, whether it's a nurse practitioner, your doctor. They probably won't recommend the herbs, but nutritional support is always good. We talked about the processed food and sugar. One thing that it will help you to relax, but it also coordinates with the airway muscles, is magnesium. Okay, it's magnesium is good for you, number one, and it helps you relax your airway muscles, but not too relaxed to the point where it's going to cause you to have sleep apnea. Valerian root, passion flower promotes deeper, calmer sleep, which helps you to get better rest, and then you don't actually be so cranky in the morning when you get up. CoQ10 and omega-3s support your cardio health, and if sleep apnea sleep apnea does affect your heart because your rhythm is off. Period. Okay, so the CoQ10 and the omega-3s definitely help you to support that. And if you have sleep apnea, I highly recommend that you take these supplements. And if you're looking for some good plant-based supplements, I have those for you as well. Okay, the natural approach can greatly help mild to moderate sleep apnea, or even reduce the symptoms. But more severe cases, I would recommend that you get professional monitoring, because again, untreated sleep apnea can lead to high blood pressure and being fatigued, and it just impairs you when it comes to your safety, because you're not getting enough sleep and you're tired. So yes, definitely have it looked at. Do not allow sleep apnea to go untreated. Definitely go and get tested and find out what you can do. I know that most of the time people get on breathing machines, so that way if they do stop breathing during the night, that they will have that backup. So definitely get monitored through a professional. Okay, that's what I have for you today. I hope this episode has added some value to your life. If it has, please share it with someone who it may be a benefit to as well, because there are thousands of Americans and people around the world that suffer with sleep apnea. So this information may be helpful to them, and they can try some of the natural remedies to see if they can reduce or even eliminate the sleep apnea. So if it has been a benefit to you, please share it. Also, subscribe to my channel so that every time I drop a new episode, you will be notified. But before I get out of here, as usual, I have got to say thank you to my listeners around the world, here in the United States, Canada, Australia, Russia Federation, China, Mexico, Belgium, Ireland, South Africa, Brazil, Nigeria, United Kingdom, Germany, France, Bangladesh, Ukraine, Kuwait, India, Hong Kong, Dominican Republic, Philippines, Barbados, Saudi Arabia, Spain, Japan, Netherlands, Pakistan, Indonesia, Portugal, and we added Singapore and Peru a few weeks ago. I'm going to keep watching and seeing how many more countries are joining us. I was told that I would reach the masses, and my goal is let me rephrase that. God's goal is for me to reach the four corners of the earth, and I am going to be here to serve my purpose. I I appreciate each and every one of you for listening. Thank you for joining me here on Thriving After 50, Mind, Body, Soul. This is Master Coach G, and I will see you on the next level.